What we did to identify partners in our community was looked at an already existing collaborative that had key stakeholders that were interested in families and childhood obesity prevention. And we looked at their different committees and asked them who were some key people that were interested in a program such as BodyWorks.
Some of the partners that we work with in our community are WIC, which is Women, Infants, and Children, the Hampton Health Department, and Virginia Tech has a cooperative extension office that does nutrition services, and they'll go into the homes and do education, also hospitals.
We partnered with a local Spanish center called Maddie Rhodes, where a lot of the people in our Hispanic population already go to for different activities. And so we actually trained about 3 of their workers within that community site so that as our program director went out to the site, they could partner with them to actually implement the program. So our partnership was not just using the site as a free location, but also having actual trainers within the center that were both English and Spanish speaking.
I work with several of the hospitals in the community. We have formed the Seattle BodyWorks Coalition, and we meet periodically to talk about how to obtain funding for the program and where we're going to have the BodyWorks programs located. And we talk about training other trainers and how to recruit.
Partnership is finding other community stakeholders that are interested and have the same goals and visions that the BodyWorks program has.
Also, to support what you're saying. You know, sometimes if you're saying something and then you have someone from another agency come in and say the same thing, sometimes it adds value to what you're already telling the parents. I believe that establishing partnerships has benefited the BodyWorks program because it helps the parents to know what resources are available. If they see WIC, Women, Infants, and Children, and then they're done with the class and then they see those people again, they already have a frame of reference.
The thing I do to maintain the partnerships with the high schools is constantly calling the teachers, making sure that they know the program is there, making sure that their students are there, and letting them know that I will do an evaluation for them and they can really get a lot of credits, school credits, for doing what they do in my class.
In our community, what we have done to maintain our partnerships is providing quarterly reports on the program as it's implemented. We've also actually had our partners come out to our community sites to see the program in action, so that way they get excited around what some of their dollars are being used for. I think our biggest challenge is ownership of the program. Sometimes we've partnered with people that have provided actual funds, and so they have always wanted to be included as people that own the program even though they didn't implement it. And so we've had to spend a lot of time explaining to partners what their role is as a partner versus what our role is and who really has ownership over the program.
I feel that the most important thing we offer to other medical professionals is an opportunity to give their parents and children, their families that they take care of, an education. And we actually take the burden away from the physician in that we're doing all of the educating that a physician doesn't have the time to do in his office or her office.
Some of the things that we offer to partners that come in and speak with our BodyWorks classes are referrals. So if they see them in the class and the families believe that this is a good resource for them, they will then continue on with services with those organizations.
The high school students that come and have community service hours with me not only learn about nutrition and exercise and proper health, they also learn how to interact with younger kids and bridge that gap and talk to parents as well.
For more information about BodyWorks, please visit womenshealth.gov/bodyworks, or you can contact the BodyWorks Help Desk at bodyworks@hhs.gov.